evening, dear CIO friends. Hope you and your near ones are safe and sound. Thank you for joining. Look forward to another great learning session together. Today's session is different, okay? And why it's different is it's a great culmination of technology and medicine science as we speak. To start the session, we will have a insightful tech orientation by NetFoundry team. And then along with this, we would have some quiz round, which will have some exciting prizes as well. So stay tuned and stay attentive, so to say. And in addition to these prizes, which you will be given for the quizzes, we would have the early bird prizes for those who have tuned in early. Then later, towards the end of the session, we would have this feedback form which has to be filled. And the initial 70 participants who would fill the form would get these some interesting prizes as well. So that's the broad theme. Followed by this tech session, we would have a session on COVID impact on enterprise IT by none other than Dr. Sujoy Kaur. Sujoy Kaur, as many would know, he's the Chief Medical Information Officer and the Vice President of Apollo Hospitals. And to start the day's proceedings, I would now request Kamal Karnatak, President of CIOs of India, to extend a warm welcome to all participants. Over to you, Kamal.
Good evening, friends. Welcome to this especially curated session on COVID impact on enterprise IT, where we would also be discussing how IT and AI can be used in healthcare. It is my honor and privilege to welcome you all on behalf of CIOs of India. As you all know that CIOs of India is a 24-year-old non-profit organization of technology professionals, and we strive to give you the best experience in everything. We also want to help towards building a vibrant tech community in India. I won't be taking much of your time, but I want to assure you that as a CIOs of India, we are committed to provide the best of class learning, leadership, and sharing. Not only that, we are also conducting a lot of fun-filled sessions. Tomorrow, we are having another family event. So if you have not registered for the same, you can register. We are conducting a lot of relevant certification program for all of you. Soon, we are going to start a certification program on AI. So stay tuned for those kind of announcements. With that, let me welcome you all once again and enjoy the session, learn as much as you can. Over to Atul.
Thanks, Kamal, for the great insights and the great work CIOs of India is doing and continue to build on it. I think we need to keep the momentum. And as you rightly said, I think we all look forward to this AI session, which we plan to have soon. And we wish that we have a good number of participants to learn and adapt on these new age technologies. Yeah. So moving ahead, let me have the pleasure of introducing Deepesh Ranjan. Deepesh is the Vice President and Managing Director of NetFoundry APAC, Asia Pacific. He brings in 22 years of experience in the telco and cloud industry. And just to give a brief, he takes pride in providing customers with network solutions and transforming their business through his offerings, his company's offerings, so to say. And he has an illustrious academic career as well. So he's got his education from IIM Ahmedabad and the MIT Sloan, USA. In his current avatar, he drives adoption of the fastest growing trend in IT networking, that of cloud native software-defined networks, ZTN and SASE. So I would request Deepesh to give a brief about NetFoundry and also provide a brief about the quiz which we plan to do during the NetFoundry session. Over to you, Deepesh.
Thank you very much. Let me know if you can see my screen.
We can, yeah, sure.
We can, yeah.
You see the PowerPoint presentation?
Yeah.
Fantastic. Welcome, everyone, and a very warm welcome and greetings from Singapore. I'm based in Singapore, and I'm joined by my colleagues across India and APAC. I have Bernice, who is based in Malaysia, joining from Kuala Lumpur, and my colleagues Sandeep and Suren from India. Surendran would be our next speaker after this, where Surendran would take you through the kind of innovation which we have created. But for me, I thought of at least introducing the organization and letting you know that how and where NetFoundry was formed, and so that at least you should have basic understanding about where are you spending time. And I am very pleased to have my MIT friend, Dr. Sujoy, who brings a lot of data sciences, analytics, and technology innovation credibility in the medical science and otherwise on this forum. And it's really a privilege to have him speak. Dr. Sujoy is actually adjunct faculty to IIT and IIMs also. So please use him. He's one of, I can say, erudites of the industry. And so it'll be great to have conversation with him. Just a little bit about NetFoundry. Now, I don't have to describe Tata Group because you are all in India, but we are an innovation out of the group, innovation done by employees. And this employee innovation got converted into 100% subsidiary as part of Tata Communication, which is a flagship telecom organization and sister concern of the flagship IT company, TCS. Where did we find this innovation in our mind? A few years back, WhatsApps and Vibers has taken over the voice and the telecom business, stormed it and almost killed the revenues of telecom providers. And at that point of time, it was a thought process that can we innovate something which is for next 10 and 20 years? And one of the challenges we thought was that Amazon and others have created a cloud services. And since you all are from IT field, you'll understand where they have taken boxes, storages, and everything from ground and created, virtualized it and made a cloud. But everybody forgotten that there used to be wire and boxes which used to connect your one server from another country, another city, and so on. So that the networking part of it was never thought to be virtualized the way you can virtualize your storage and boxes. So we decided to bring an innovation where we could actually virtualize your network, and you can spin up a network like how you can spin up a virtual machine today. You can delete a network, and you never thought about deleting your wire and boxes, but now you can delete a network, you can export a network, you can save a network exactly like how in the virtual world, in the cloud world, you can do it. Suren is going to explain more about it, but we take a pride in creating something so innovative that in 3 years of time, we have built two platforms. One platform which brings virtualization to the network, the another platform which created a software development kit called ZT, which could actually embed inside the applications and software itself. So imagine an application and software having networking embedded inside. So that's the kind of innovation we have brought. With that innovation, today we are recognized and there is a lot of accolades. We are recognized by Gartner. Forbes has talked about us as one of the sexiest innovation in the network world. You could find about it. CRN has named us as top 10 networking tool and tool to use. We've been awarded by various different platforms. I personally got an award for the innovation in Singapore by Singapore Business Excellence Awards. But IoT and Cloud Innovation Award is a key where Google and Amazon's have won that award in previous years. And NetFoundry, just as in a startup building something new, was given an award where we have beaten more than 50 companies like Oracle's and others in that. Morgan Stanley, which has a CTO Innovation Summit, picked us NetFoundry amongst 2,000 companies with the best software-defined networking platform last year. And Zoom, Splunk are the companies which are alumni of the CTO Innovation Summit of Morgan Stanley. We as a company, as a startup, just 3 years old, we've been powering company like IBM, Watson, Microsoft, Micron. What does that mean? These companies which you can see on a screen, they use us not just to build their products, but they have embedded our platform into their platform to provide services to their end customer. And just to give you a perspective, IBM Watson embedded us inside and provide a voice AI to text services to their customer. And so Microsoft is doing for 5G, and Micron is doing for connected car, and so on. We've been transforming different telecom companies around the world. Telenor, Europe's group, PLDT, Philippines, #1 telco, Axiata, Indosat, Indonesian #1 telecom company. So we have been transforming even the telecom industry in that sense. But most important for all of you to understand that we've been connecting all the cloud providers. You pick a cloud, Amazon, Alibaba, Azure, and you can literally jump on and connect with extreme speeds and performance and security to the cloud providers. I will let Suren explain about it in a couple of minutes to all of you. But just a final thought before I will hand over to Suren to bring a perspective of Gartner, because most of the CIOs and CTOs have one common theme, that how much Gartner has recognized you, because Gartner seems to be one single pillar where they go very deep about understanding technology and really recognizing companies. And not only Gartner has recognized us as a cool vendor this year, but also they have featured us in a particular paper where they have said there are 3 companies who have really sailed through and leveraged the pandemic, BSpin Global, Zoom, and NetFoundry. And you could go and really read that study. But Gartner has now recognized us in 3 different platforms. One, as a zero trust networking provider. Second, as a multi-cloud interconnects, where our ability to connect to Amazon, Azure, Google, and different kind of cloud providers in matter of seconds. And also as an option to CSPs to look at us as an option to replace virtual private networks or any kind of work from home and work from anywhere kind of scenario, where we could replace all the kind of security and networking technology and use the just software as a platform to build that secure access as such. With that, I would hand it over to my colleague, Suren. Suren is our leader on technology in India. He would be your best friend if you want to interact on how NetFoundry does these innovations. And he would be very keen to have more and more in-depth interaction with all of you in future. So over to you, Suren, and take the audience, in terms of how we work and what we do. And once Suren finishes, I would request my colleague Bernice, who is our marketing manager based out of Kuala Lumpur, to take you through a very interesting quiz. And that quiz will allow you to win prizes and so on. And that's one of the fun things to do over here. And once Bernice finishes that, then the last session, which we have kept as the most important session, is our Chief Medical and Information Officer, the erudite Dr. Sujoy, to talk about how the pre-COVID world, post-COVID world, the IT, the artificial intelligence, machine learning, all of this has impacted the world, and specifically how in the technology is impacting the medical sciences. So please hold yourself for that. Over to you, Suren.
Thank you, Dipesh. Yeah, let me share my screen. I hope everyone is able to see my screen.
Yep.
Yeah.
Great. Thank you, everyone, for joining the session today. Welcome again on behalf of NetFoundry. Today, we're going to look at how VPNs, as traditional methods of technology, have been posing challenges to enterprises from a security standpoint. We're also going to see have a brief introduction about what's zero trust and how NetFoundry has built a zero trust NAAS platform and delivers work from anywhere solution to enterprises in this COVID time. And finally, we will have a case study about NetFoundry, and if time permits, we'll also walk you through the NetFoundry console and how the NetFoundry console is easy to use and is letting enterprises and enterprise administrators spin up their networks on demand, right? So what are the things that are broken in the current method of VPN security? And what are those, let's look at what are those challenges associated with those challenges in the VPN architectures. The first and foremost important problem that the entire industry is trying to solve is how do we look at better methods of authentication? Reliance on IP addresses, username, passwords for passwords for authentication have been a very weak chain that have been kind of exploited by hackers, especially password hackers. And in the VPN world or the traditional world of VPN architecture, the trust is always one way, which means anyone can, any endpoint is allowed to go and authenticate itself with the central VPN servers, with the VPN server certificate. But there is no authentication at the endpoint, which is trying to initiate the connection from a trust perspective. And this weak chain is exploited by hackers with attacks called as endpoint impersonation attacks. They impersonate as if they are a trusted user, an internal employee of the organization, and try to break into the network. Now, there is a lot of development around software-defined networking. There's a lot of expectation in enterprises to have better policies and control. Now, for achieving all this, the traditional VPN architecture acts as a bottleneck because it just has one single big pipe, a tunnel, an IPsec tunnel or SSL tunnel, for carrying both control and data messages. Therefore, the possibility of restricting endpoints at the edge and not letting them come to your network and then enforce policies is lost because all of this data comes through one single pipe. We are living in a hyper-connected world, and in a hyper-connected world, not only are internal employees accessing applications, we are exposing resources to partners, customers, people who do managed services or infrastructure managed services for enterprises. And having all these types of traffic and different types of users in one big network exposes the chances of attacks. And I can give you examples of how Target Corporation lost around millions of credit card user information. And the hackers actually came through a HVAC network, right? So had they restricted the HVAC IP network and isolated it from their internal network, the attack wouldn't have moved laterally. So, and those are some of the challenges and practical examples of how overprivileged access can affect enterprises and cause a lot of revenue loss. And in the VPN world of establishing connections, the firewall or the central concentrator is always open to connections. It is constantly waiting to receive traffic on port 443 or 80. And therefore, that is where hackers and attackers and people who are watching internet IPs are constantly trying to hit those firewalls and trying to force traffic. And then you're trying to protect your resources with multiple layers like intrusion detection, prevention, and DDoS protection and all that. But why do you want to have such an architecture where you want to keep connection requests open, right? Can we look at a better alternate? And in today's world with adoption of SASE and enterprises opening up browsing, 10 years ago, we all know how much of browsing was allowed in the enterprises, but today you cannot stop employees from browsing. And when you try to mix browsing traffic or web traffic and enterprise private traffic, what are the challenges that you have? You're exposing unintended data and unintended traffic to intended and secure traffic. So those are the challenges from an architectural perspective in the traditional method of establishing internet-based networks with VPNs. Zero Trust is a framework, as you all know, that was kind of launched by NAAS, National Institute of Standards and Technology, USA. And this framework is being adopted by enterprises and industry solution providers. Now, Zero Trust is an innovation, I would say, which is a result of trying to find solution to the problems that we saw in the earlier slide. Those are all the problems that enterprises were facing, and internet is here to grow. And how do we solve these challenges? And a researcher in Forrester made a paper on zero trust, and it is adopted by NAST. NAST paper 800 is available for our consumption on internet. We can go through that. Now, today we're going to see in high level the concepts of zero trust and what zero trust preaches, and how enterprises can kind of try and adopt these principles one by one as part of your plan. The first fact that zero trust wants anyone who's implementing this architecture to acknowledge is that we are living in a hostile environment when it comes to cybersecurity. We're surrounded by hackers and attackers who are trying to steal information and hurt our operations. With the adoption of cloud, with the adoption of policies such as BIOD, on one side, the applications have gone out of your premises. You know, they're sitting in cloud, they're sitting in SaaS, they're sitting in PaaS platforms, and users as well. They're no longer within your premises and accessing only those hard-coded desktops. They have laptops, they carry it home, and they are using mobile devices to connect your network. So those walls that used to exist in the perimeter method of security, which is the firewall, internal and external wall, zero trust architecture believes that those walls no longer exist, right? And therefore, you cannot essentially always differentiate between internal users and external users, internal resources and external resources. It's kind of a very complex environment. Therefore, there is a need for us when we design networks and design our systems to always verify every endpoint, every user, even every resource at some times. And not just blindly trust everything and anything just because it's our own employee, our own device, and our own network. So that is very phenomenal, and that's a fundamental belief that people who implement zero trust carry. Now, after verifying an endpoint or a user or an app, the zero trust process or the zero trust lifecycle doesn't stop there. The verification itself is a continuous process. They call it continuous trust. It's not one-time trust, it's a continuous trust where you always try to authenticate and kind of authorize every endpoint or user who's trying to access your data or app. And that is where zero trust preaches that you need to move away from overprivileged access, where everyone has access to everything. And you move away from there to what you call as application-specific access, or least privileged access, where you authenticate and authorize every endpoint which has to get connected to access your apps and data on your network. So that summarizes zero trust in brief. It's a very interesting topic. Zero trust is here to grow, and zero trust is already replacing the traditional VPN architectures. And you already see many of these VPN providers who are selling firewall-based solutions, trying to buy or invest startups so that they can stay relevant in the market. And it is happening across all OEMs who've been selling erstwhile VPNs. Introducing NetFoundry Zero Trust SASE and NAAS platform to you. NetFoundry has built a platform that delivers an internet-based WAN solution with cloud-native security features like zero trust that we just discussed, and so many others like secure web gateways, integration with endpoint detection and response, cloud access security brokers, and so on. The way we have built this platform is we have built this with 100% software running on cloud with underlying software-defined networking principles that lets any enterprise create a secure overlay network with their existing internet. So when an enterprise wants to have an internet WAN connecting, so for example, users working from home or working from anywhere to securely access applications in private and public clouds, or when an enterprise wants to have a secure IoT network to connect IoT devices to the IoT cloud or platform, the NetFoundry Zero Trust SASE and NAAS platform is helping enterprises to provision these networks on demand and at a very short span of time. Now, how are we doing that? NetFoundry believes that the method of NAAS, the method of delivering NAAS has to be 100% software. The reason is when you look at hardware-based models and when you look at hardware-based integrations, there are a lot of challenges in hardware procurements, hardware installation, and then you lose flexibility. Therefore, apart from building a 100% software-based platform, NetFoundry has built software endpoints or software packages. These software packages can get into laptops and desktops like Windows, Mac. It can get into mobile devices like Android and iOS. It can get into IoT gateways for establishing a secure IoT network. And as Dipesh was mentioning, we have established a marketplace presence in 7 major public cloud providers where people who have adopted public cloud or hybrid cloud strategies can just spin up a network to connect to any public cloud in just 5 minutes. So a quick summary, the NetFoundry platform is delivering zero trust security, and it also delivers the SASE benefits, which is again a Gartner definition of combining multiple security layers delivered out of cloud or cloud edge. And the entire solution is delivered as a NAAS, network as a service. And you could use this platform for various use cases, which might be applicable to the enterprise, whether it is work from anywhere or IoT or connected supply chain or B2B and so on. But the one fundamental fact is you have a network that you want to build using internet as underlay, and you have some kind of a cloud adoption, on-prem, public cloud, and things like that. And you want to solve the challenges of security, agility, and you want to have the service on a subscription model, like how you consume cloud or SaaS or PaaS. Now, as a startup, NetFoundry has built, we believe we have built the best zero trust security platform. The reason why we say that is we do not have any baggage to carry. As a startup, we have very thoroughly understood the Gartner model of SASE. We very thoroughly understood the zero trust security model, and we've been able to deliver the best zero trust security for enterprises. NetFoundry delivers multiple layers of security as part of zero trust. The first layer is we have moved away from username password-based authentication to digital token-based authentication, which is not human-driven, but machine-driven. So this helps us to do away with the username password-based password hacking attacks that we saw in the earlier architecture. And for any endpoint to get into a NetFoundry network, it has to first get itself authenticated even before coming to your, what you call your edge or your data center or your perimeter. NetFoundry has implemented both link security as well as end-to-end security. Link security we've built with mutual TLS. Many of the existing solutions just do TLS, but we do mutual TLS. And we do end-to-end security via end-to-end encryption. And we are using the latest Poly SASE security encryption, which is not only tough to break, but also very lightweight. Now, why I'm saying this is because in today's work from anywhere environment, post-COVID, or in future, which is good, we're going to continue accessing applications from home, from mobile devices, and still we are living in constrained bandwidth environments when we are traveling and so on. So these kind of technologies at all layers would help enterprises have better application experience. And NetFoundry kind of splits the control signals and data signals so that we are able to enforce security even before the endpoint wants to initiate a connection. And this is a software-defined network, by the way. And NetFoundry establishes two-way trust. So when we looked at the zero trust principles of continuous trust, NetFoundry, based on that, has established two-way trust, not only at the controller or the fabric level, but also at the endpoint level. So these two get always exchanged and continuously checked. And one of the important things that we have to definitely look at to prevent attacks is prevent attacks that are originated from internet towards the network. And therefore, as part of zero trust principle, NetFoundry allows only outbound connections from the endpoint towards the internet or from your data centers towards internet. So we are kind of avoiding around 70 to 80% of attacks. 20% of the attacks can still originate from your users themselves, but still we are reducing around 70 to 80% of attacks. And NetFoundry provides application-specific WAN networks where you can have application-specific WAN for each of your business units or critical and non-critical apps, like a finance, like a sales, and so on and so forth. And you don't have to put everything in one big basket. To summarize, the NetFoundry's Zero Trust NAT platform's benefits, it's an agile solution. Against traditional architectures, which are allowing users to connect to applications going through multiple hops, you first come to the data center and then take another hop and then another hop. That kind of an approach doesn't exist in NetFoundry. Users are able to connect directly to the application wherever it is hosted. And NetFoundry allows any device or any application to be accessed or used within the allowed policies of the enterprise. And you could connect to applications that you're hosting in private data centers or any public cloud. And NetFoundry is a very simple solution to use. We have built a console that is very intuitive, very simple to use. It's a web-based console that lets your administrators, may not be necessarily network administrators or high-skilled people. They can be app administrators, network administrators, and some of our customers are also letting the business owners kind of manage this console. And NetFoundry allows you to do a simple on-demand provisioning with that console. NetFoundry does not involve any hardware investments. It's a 100% software-based solution which can get into virtual machines and laptops and desktops and all that we saw. So there is no need for you to buy and invest in, have CapEx investments on hardware. And NetFoundry also simplifies how organizations with hundreds and thousands of people can automate the endpoint lifecycle. And there we can integrate with your existing Azure Active Directory and automate the entire lifecycle of endpoints. So whenever an employee joins an organization, we create an AD entry and an endpoint access is provided to the employee. And whenever the employee leaves the organization, you will obviously remove the AD entry and they lose network access. So you kind of automate even network access. The last but very important benefit of NetFoundry is security, because it's a zero trust solution. NetFoundry allows you to do application-specific WANs. NetFoundry allows you to provide access to resources for employees only after they go through the various security posture checks. So you can define posture check requirements based on operating system, domain, different processes that have to run, or even MAC addresses that have to be allowed into the network. So it's a very, that's a solution that allows you to have a lot of control and prevent attacks from entering into your network. So that's the summary of the benefits of NetFoundry Zero Trust Access. I hope it is useful. Please do let us know if you have questions during the Q&A session. Now we will look at a couple of case studies before we go to the next section. Now, when COVID struck, many organizations were looking for business continuity solutions because all of a sudden people were not able to travel. And there are so many industries which are doing critical services, like this customer of ours who's into the healthcare industry, and they've been supporting hospitals and various other healthcare providers around the world. So in less than 5 hours, we onboarded nearly 1,100 employees who moved to their hometowns with or without company provided laptops with zero trust solution. And they were able to go live the next day. We actually did it during the weekend. And this solution has been endorsed by none other than the ex-chief security officer of Google, who's present, is a member of the board in Epexon Health. And the customer, since COVID till now, has been expanding in their business because of healthcare is doing well during the COVID situation, and they've been able to automatically onboard more and more projects and users in the healthcare industry. One key benefit that I would like to say, amongst all the other benefits that Epexon has kind of enjoyed with NetFoundry, is Epexon is kind of catering to 10 different healthcare projects. Now, healthcare industry is very, is very kind of, the enforcements of the policies is very strict in the healthcare industry. And each customer has been provided their own micro-segmented app WAN. So one project employee and another employee is working on another project, one application dedicated for a particular project and another application which is used for another project. They do not speak to each other, or they do not overlay at the network layer. So this has been a very, very useful feature. And with NetFoundry's reporting and analytics, the customer is also able to charge back each of the businesses for whatever investment they've made in our solution. The other very interesting case study of NetFoundry is one of the leading software development companies based out of India, who's been building ERP and HRMS solution for the last 1.5 decades. Wanted to move away with VPNs because VPNs were posing security challenges, and they were having a lot of challenge with agility in the organization, because every time they wanted to access a server or an application, they had to go to IT. It had its own time, waiting time. And they wanted to solve all these challenges of agility and security with NetFoundry. And we've onboarded around 1,500 plus users. And being a product development company where 85% of their employees are building software products, the number of apps and servers are very high. And we've kind of onboarded around 1,000 plus apps and servers. And this is a hybrid environment where they have spread across in their on-premise data center in Chennai. They also have apps and workloads running out of AWS and Azure. So that's the summary of our case studies, some examples of customers whom we have helped in the post-COVID period. With this, I think we can move on to the Q&A. Any questions? Let me look at the chat window.
I think I'll request Ashish if you can take the questions up, please.
Yes. Good evening. It was a fantastic, session, Surendran, and quite insightful from SASE to ZTNA, and outstanding offering. I've got a question from Jay Daga. Jay is asking that it's a unique and good solution. Would like to know how does it add value or complement a SaaS-based solution?
For a SaaS-based solution, which is software as a service like Office 365 and all that, I believe. Right. So very good question. Now, if you look at the SASE framework, the SASE framework looks at addressing the requirements of zero trust security, not only for private applications, which are hosted in data centers and public cloud, but it also looks at how we can secure traffic that goes to SaaS platforms like Office 365 or Salesforce and so on. So in the SASE model, there are two key components. One is the private access that NetFoundry ourselves deliver, and we also have partners with whom we deliver the secure web gateway solution. And these two have to get integrated for you to have a single console and a single dashboard. So that's how NetFoundry can help you to have an integrated SASE model where you have SWG, secure web gateway for SaaS traffic. Also have NetFoundry ZNA for traffic towards your private and public clouds.
Okay, I hope that answers well. The second question I have from Sandeep Kothari. His question is, how does the solution require to comply or follow ISSAF and FFIEC standards?
I haven't actually looked at it, to be honest, those requirements on the standards, but we have we are compliant to SOC 2, we are compliant to the requirements of HIPAA and all that. So we'll have to look at the controls and clauses in those standards, and we'll have to see how we comply to that. But what I want to tell you is zero trust paper 800, NAAT paper 800 that we comply to is one of the toughest standards, I would say, in terms of security standards. And I'm sure we'll be able to comply to those standards. We'll have to have a look at it, to be honest.
Okay. Maybe Sandeep, if you have any follow-up question, you can put it on this. I am also not sure ISSAF and FFIEC standards are part of which industry. The other question I have is from Umesh, and he's asking, does it support any DLP functionality? Very interesting.
Yeah, very interesting. So in my SASE slide that I was showing, I had a section which is EDR, right? So DLP is kind of moved under the EDR combination. This space is very rapidly growing, as we all see. We all know that, right? So NetFoundry, what we have done is more than 50% of market share on EDR is held by Microsoft. They had a product with the name Intune, which they have renamed as Endpoint Manager. So like Microsoft Endpoint Manager, there are many EDR solutions like CrowdStrike, SentinelOne, and so on. So with our API capabilities, NetFoundry integrates with these EDR solutions. And if the EDR solution says my device is compromised, I shouldn't be let in. NetFoundry listens to that via the API and doesn't allow the endpoint into the network. So we integrate with these solutions.
In fact, I wanted to check whether the solution is an agent-based solution or it's
agent-based solution.
It's an agent-based. That's how you check
yes.
the machine before getting connected to it.
Yes.
Okay. The other question I have is from LL. His question is, how does the NetFoundry solution work with customers' existing security investment, especially on IAM, PAM, firewall, and SAME?
Very good question. So many of these solutions will exist as is, because you will still need layers like firewall, because you still have web-based content going on. Your company might have web-based applications hosted. So these layers will exist, and NetFoundry will add to the strength of these existing layers. The load on some of these layers might come down. Now, what I'm saying is, as we saw the model in Zero Trust, where we don't allow inbound connection requests. So the requirement for IDPS and DDoS protection, or the load on these layers will definitely come down. You might still need IDPS for public internet facing workloads, but it will come down. And for solutions that you have like SIM, right? NetFoundry APIs can pass event logs via APIs to SIM, so that whatever you could see in the NetFoundry network with your endpoints can be passed on to the SIM platform for a unified view, and we can do that. And our customers have been doing it. That, say for example, with Splunk,
Okay, so it integrates with all the standard SIM solutions.
Yes.
I've got so many questions pouring in. Atul, how much time do we have for this Q&A session?
I think we can ask one or two questions, and then we can move on to quiz.
Okay.
Then if there are other questions, we can take last.
Right. Next question I have is from Saurabh Gugnani. His question is, how can help me to optimize on this solution, which I have vis-a-vis onboarding this solution, as it will be a complete CBA. So can we try and bring Saurabh on the screen, because I'm not sure about the question. There is another question from Arun Gupta, which says 90% of our end user devices run on Linux, and balance is a combination of Windows and Mac. How can I use NetFoundry in such an environment? So
we have software packages for Windows, Mac, as well as Linux. So you could choose whatever package of your, based on your devices of your choice.
Okay, wonderful. There's another, you mentioned in your presentation that you use, in terms of authentication, you use token-based access instead of the username password. Does it integrate with, access, library like Active Directory, which is on premise, or it is only O365?
It can be done, but there is a reason why some of the traditional solutions are dependent on Active Directory, because they don't have their own digital identities. But what NetFoundry has done is we've built our own digital identities, for example, JSON Web Tokens. And these are endpoint specific identities, and these are identities which have its own expiry. And it's very unique and more robust, and has got more security strength than having a username password access based on AD. So we have two levels, two-factor authentication in a different way already built in NetFoundry. But if you want to have the third level of authentication, then we can integrate obviously with any IDP, an Azure Active Directory, or an IDP like an Okta or a Ping Identity, right? So that's definitely possible, but that becomes a third layer in NetFoundry because you already have 2 layers of authentication.
Understood. And the last question is from Ram Kumar Mohan. NetFoundry, does it complement with other existing security control, endpoint perimeter, or?
Yes, yes, it complements. We can integrate, as we looked at the example of EDR integration, IDP integration, SIM integration.
So you're saying that it can be completely, integrated with the endpoint security solution?
Yes, yes.
Wonderful.
That's how the enterprises can look at the SASE framework, right?
Right. So yeah, I think I'm done with the questions here. There are a few more questions. We'll probably take that up later. With that, back to you, Kamal and Atul.
Let's move on to the next part of the session, which is the medicine part. No, we spoke about the medicine and the IT confluence. So today we have Sujoy Kaur ji. I think, let me put on my video as well. Sorry, give me a sec. Yeah, so let me introduce you to the speaker, Dr. Sujoy Kaur. And as I mentioned a while back, Dr. Sujoy Kaur is the Chief Medical Information Officer and Vice President at Apollo Hospitals. And those who would not know, but he is also associated with IIT Kharagpur and IIM Calcutta as adjunct faculty. I think that's phenomenal, I must say. And he is been the Director of Medical Services at Apollo Hospitals in Calcutta, and he did his postgraduate MD in clinical microbiology and infectious diseases. And he's an alumnus of MIT Sloan School of Management, a Six Sigma Black Belt holder from the Indian Statistical Institute, and he's a member of many professional organizations, so to say. And I think I would request now Dr. Sujoy Kaur to take us through and know what great work he would have done in the medicine field, so that we can take some cues and take some insights and which we can take in our respective enterprises. Over to you, Dr. Sujoy.
Good evening. Am I audible?
Yes, very much. Great.
First of all, thank you very much for inviting me to this forum, CIOs of India. Thanks, Dipesh, for the invitation, Mr. Sandeep, Bernice, and of course, what a lovely talk that we had from Mr. Sundar. That makes my work a little easier because I'm not going to touch those topics which have been already touched as a part of what my previous speaker has just spoken. What I'm going to talk about today is not exactly about how the world will look like in post-COVID. It will look very much the same from the ecological point of view or other standpoints. But it's in how we do things is definitely going to change. And that is something that we have learned, and we've learned fast. That also is something which is very valuable from a sustainability perspective, and of course, the resilience of organization to actually come back from the hit that they have all got. So in this talk, I'm going to touch about a bit of work that has been done at MIT CSER, which is the Center for Industrial Research. I'm going to talk about a little bit from the recent studies from McKinsey. I'm going to talk a little bit from the work that Broadband Commission has recently published, and I'll introduce you how and why Broadband Commission is important. And then I'm going to take you through the use of AI in health, artificial intelligence in health, and where we possibly might need to think through and move ahead in a different perspective or a different way. So my disclosures are that all of these references that I'm going to talk about are purely from academic purposes and are from published sources. And I'm not going to talk today about any proprietary research that is ongoing and is not published so far, because that would lead me into trouble. As I start by saying, for every organization post-COVID, we are going to look into the elemental form of digital transformation. And nobody better than Caesar actually talked about, the elements or building blocks of digital transformation. They talked about operational backbone. They talked about shared customer insights. They talked about digital platform, accountability framework, and external developer platform. In today's talk, we're just going to talk about a little bit on the operational backbone, customer insights, and of course, on the digital platform. Digital platform is a coherent set of standardized business processes.
Dr. Kaur, apologies for intervening. Your video is off and there's some echo coming in.
You're getting some echo?
Right.
Right. Just give me a minute.
And there are some audience who is looking for your video, Sujoy, so maybe you should switch on your video.
If there's some problem, I cannot do both the things. I'll do the video when I do the question answers.
Yeah, that's fine.
Right. So going back to the platform, digital platform, which is a coherent set of standardized business process, where we're looking at shared processes, data, application technology, and who better knows than all of you here. But there has to be, for every organization, a digital strategy. I'm particularly talking about non-IT organizations, where they need to look at it from the perspective of customer engagement. They need to look at their digitized solutions. They need to look at their operational backbone. And then from that perspective, look at digital disruption, which is bringing about in your competitive environment, the use of digital technology, which is, of course, brought in by the new market entrants or some of the changes that happens within the established competitors, and undermine the viability of your product or service portfolio for a go-to-market approach. So in most of these ways that you'd have to think through the customer engagement, the solutions that you have in your way, and we got a fantastic view of that from the NetFoundry in the beginning, and the kind of operational backbone that you would like to look at it from that perspective. So McKinsey went in and did a research somewhere in June this year, and then identified from a customer's perspective, what were customers looking at this point of time in COVID? They were shifting to value and essentials. They were not spending money into something which was thought to be what we call as extravagance. And they were looking in more and more because of the COVID climate and the environment around with this, where you have to stay at home or reduce your going outside and interactions and stuffs like that. A lot of people had to work from home. The flight to digital and omnichannel. But what it seemed was that there was a shock to loyalty for many of these companies at the same point. What they said is that the one who were providing them with better digitized solutions, who had a better operational backbone to fulfill their needs, they were moving towards that. And that is where, for people who are affected by this, there are 4 actions that have been suggested. The first is focus on care and concern, which is about reach out to people with support, not just for marketing purposes. Make priority in people itself, whether it is your inward customer or outward customer, in employees and in community. And community building is probably one of the very important thought that comes in healthcare, particularly if you look at the examples of how Mayo Clinic have built it, or how Cleveland Clinic can build it, or how even NHS works for that matter in England. And then stay true to the company value and purpose. The next is innovate digital models to help customer weather this crisis safely. So, you come with more innovation into this. So healthcare move on from face-to-face consultation to virtual consultation. For people coming and picking up things from pharmacy to ordering medications online. And then expand this to deliver at home and, move into something which would lead to contactless operations. And reimagining the post-COVID-19 world would have to have that, and the CIOs as well, have to take hard decision on cost cuts. They would have to migrate their customers to digital channels and to save money and boost satisfaction. And of course, brick and mortar stores may look very different post-crisis in that way. The last one is about building agile capabilities for fluid times, which is like, ask, tap social media, not surveys for quick customer readings. And there are 2 or 3 other suggestions that comes from that. Operational backbone. And this is something which we are taught, and I often use these slides in my own teaching, is that organizations always have 2 ways to look at: standardizing their procedures and integrating their different IT processes in a way that they give the state-of-the-art work. Now, if you look at here, people who are low on standardization and low on integration, they are in somewhere where we're looking at in diversification. And initially, banking services and all of that were there, in which they were independent units where they did not, and I'm talking about early 2000s or late 1990s and all of that, where the diversification was type of business. And people were making money in that. It's not just that they were going into loss because of the systems and all of that. Yes, you did have shared administrative service. You did have an infrastructure technology that would actually help in that. But if you move up the scale from an integration perspective, you move in a more of a coordination way, where unique business units with a need to know each other's transactions begin. So you need to now talk about what are the transactions happening at the different units, and you begin to look at customer and product at that time. Replication is a very interesting thing, where you do not integrate too much, but you are actually standardizing your processes in a much more definite way. And that's where even in healthcare, we see a lot of accreditation, a lot of stuffs like that without even going for integration. They would like to correct their processes, and doing that, look at their operational processes from the perspective of that. It doesn't matter whether you make the journey from diversification to unification through replication or coordination, you would end up making your business processes more robust if you are at the high end of both integration and standardization. Now, organizations who have not been able to do that previously, their whole digital transformation perspective would need to look at, from their industry, their standardization perspective, and from the IT, the integration perspective, to bring them together to move fast. And we saw a brilliant example that one of these organizations was doing this in a span of 9 hours? And I have a story of here, something which people took it for 9+ years. This is Trinity Health case in 1999, where these were the diverse healthcare processes. And I'm sure you are not able to see them properly, but I just make an impact that all of these were different processes run by different IT solutions at that point of time. And so if you have one person who has been in one of the Trinity Hospitals network, and they were coming here with a particular disease, they will not have their records, their clinical diagnosis, their lab reports ever available to them if they were going into some other hospitals in other cities, but also belongs to the same Trinity network. And that is something which was something that was not working for that organization, because they neither had the standardization on one end, nor the aspects of integration at that point of time. It took them 9 years to go and move into a situation where all of their clinical processes, operational processes, were integrated with solutions, and they were talking to each other And not only within the organization, but also when they were moving from one hospital to other. And look at it, that particular digitized solution, operational backbone, how it is now enhancing the customer engagement and customer support piece, where they don't have to worry about, taking their physical records and move into that directions. McKinsey also came on to say, what and how do you improve your digitized solutions over a period of time? And I'll take a piece of it when I describe the AI in health in that way. First of all, it said, refocus digitized or digital efforts towards changing customer expectations, aligning organizations' new digital priorities, talk about the multi or omni-channel parity, or see how you are going to see it against your competitors. But most importantly, look at how you are able to access the performance of clinical decision support or critical decision support system. So critical decision support in healthcare becomes more clinical decision support system. Recalibrate and rebuild models and develop next generation data sets and models for optimal performance. With this, I would like to now quickly move on to the AI part and give you a picture of how much healthcare at this point of time requires digital health solutions and AI. There are about 20 trillion expected global spending coming up in by year 2040. There is a tremendous amount of healthcare shortage, healthcare workers shortage across the world, right? If you look at India, if you look at other low and medium income countries, this disparity between number of doctors or clinicians, nurses, hospital beds versus, a number of people around or the population itself is going to be very, very, there is a yawning gap coming out in that. And then we would also have to realize that many of our population are now going to be aging, and they will require more and more healthcare support in that. And of course, then this is again going to get into more into your cities. 70% of your people will live in cities by 2050. And you would have a humongous amount of underserved population. And therefore, to reach out essential services like healthcare, you would require very strong digital health to come in. Finally, if you look at the aspect of one of the things that we learned during the COVID is about the misinformation and disinformation that has been going through. And there's a deluge of misinformation and disinformation that goes around all of these spheres. It may be about diagnosis, it may be about treatment, it may be about care, it may be about when to seek care, and then a lot of people who have had the illness, what would they do? And we get to see a lot of people sick after they have recovered from COVID. I'll leave that to the question answers. If there are specific questions on this, we would answer that. But in the interest of time, I'll just move into that. So what it does to the entire maturity of roadmap for artificial intelligence, particularly in health, is to build around people and workforce, bring around absolute education, appropriate education, training, agility, workforces, and talent, and making it more empathetic in that way. The next thing is about the data pipeline. You cannot do AI without an appropriate data pipeline, particularly in clinical areas. And with the kind of the privacy laws that we have, whether it is GDPR in EU, or whether it is the HIPAA in US, or the data protection bill that we had in 2018 in India, things are going to get changed. And you will not be able to share in a lot of data just by the way that you have been doing the conventional research and all of that. So that's where, the cloud becomes very important. That's where we start beginning to talk about differential privacy or doing computation on anonymized data. We start talking about homomorphic encryption, where you are actually doing a lot of computation or using your AI model. And I say this because we actually did that. One of our work that we, in collaboration with Microsoft, where we actually used an API in a hospital or in in Western Europe, where the data never had to move. It was that API that was extended into the cloud, and they could use that API and validate the algorithm that was built in India. And of course, the governance and regulatory perspective, the design and processes, and the whole new idea of data collaboratives across the world in terms of partnerships and stakeholders. And finally, there are a lot of dollars spent. How are you going to earn that dollar back? That's something that you would have to think through in terms of using those platforms in a better way, in funding incentives or the partnerships that you would roll in. Let me now come to the clinical part, which many of you might have been waiting to see through and all of that. And this is very, very interesting. One of these things around the data for the AI in health is about the four things that comes into the standard definition of AI in healthcare or big data in healthcare. Volume, and you can very easily understand the amount of volume of data that is generated in healthcare. The next is about the velocity. Then, of course, the whole perspective of the variability of data. And this is the example of the variability of the data where you are looking at, data can be from starting from the genetics, from the genome, from the transcriptome, which is nothing but when the gene breaks down to a transcriptome, a proteome, a metabolome, and microbiome. And you can take it from the environment, the exposomes, the data comes and hits you from different areas. And then you have biosensors, you have social graphs, you have imagings, you have EMRs, and all of that data, which is coming at a very high velocity, in terms of whether you are beginning to use now the wearables or contactless sensors for routine viral monitoring. And we have seen that happening during the COVID. And this paves way to gather and process thousands of data points from patients' vitals in a very short span of time. When this data is modeled to provide highly accurate alerts or early warning signs, including the patient's current conditions, comorbidities, medication, lab values, you go around this. But what it does is it actually reduces a lot of false alarm for which your doctors or your nurses, or even for that matter, the patients themselves would be unnecessarily worried. And that could save time and that could save cost because you are only looking at things which are absolutely looked at or necessary to be looked at. However, it requires scalability and computational power. Scalability is a fundamental requirement to leverage the benefits of clinical AI. Healthcare organizations require that technological capability to store and meaningfully use longitudinal patient data by deriving clinical insights. Organization can build faster AI capabilities by bringing data from multiple sources, as we talked about medical devices, wearables, personal health records, and all of that. And then use the power of scalability and cloud computing to further and distributed federated learning, the example that I just gave it to you for a model that we prepared in India was the model that got validated in Western Europe. So that is the power of computation these days, which we have to leverage to, take it from the perspective of building in healthcare. This is another work that I was associated about 3-4 years back, where we were actually looking at motion sensors and using the AI capability to identify people who would be at risk of falls. And I know that there are several of these solutions that are currently undergoing in the worldwide. But this was done by a friend who was a Sloaney, and at the same time was from Singapore. And we walked around, even identifying gait analysis, identifying people who would require this kind of solutions being at home. Now imagine a 65-year-old man or a 75-year-old man who is barely able to stand up or use the washroom. And I'm going to give you an example at the end of the talk about that. They have a very high chances of falling at the hospital, and the cost of the fall, it could lead to something from skull fractures, brain hemorrhage, and we've seen lots of bad things around that, including fractures of pelvis and all of that. And in old ages, you are not going to help them out in any ways by treating them from these conditions. So it has to be a way that you would be able to identify these as an early warning and assign people who would be helping out for these people to do their daily living work or kind of things that they would like to do. This is the work that I do. No AI in this. This was when I was again working at Kolkata. We just took away by the data of the last 3 years and mapped them or geotagged them with where the dengue patients were coming to the hospital. And these were the months of August, September, October, November, and December. And there was a very, back in 2013-14, people in Calcutta used to believe that by the time Durga Puja ends, that's on the Dashami, the dengue also ends. But what we were finding was that after the Dashami, the dengue actually changes its genomic structure. And we were finding that they were becoming more lethal, leading to people dying at the hospital. So this was about time in November where people were dying more. The mortality rates were higher with dengue because of the antigenic variations and stuff that happened with the dengue virus. Now, when we showed this to Kolkata Municipality Corporation, they said, hey, look, so what we need to do here is this, that we cannot have the anti-dengue drive in the city just till Durga Puja. We need to extend it to probably Christmas and see how it does. And so they did that in 2015. The number of cases went down considerably. And then, they said, with the success of that program, they said, why don't you do it across the year and see more and more mosquito-borne illness go down by that way. So that's the power of data, that's the power of analytics, visualization by which you can actually do impactful activities into the society. I want to go into a particular case study, very interesting. That's where we bring in AI, design thinking, and health together. This is about a 6.5-year-old girl who suddenly, after evening playground visit, came back home and started having seizures, right? Fits. And when she was having these fits, so she went to her neurologist, the pediatric neurologist, and the first thing that the guy does is says, go and have an MRI. And anybody who have gone through MRI here would understand how claustrophobic you feel for 45 minutes when you actually do the MRI, right? For people like me, they have to make these bores of the MRI a little bit wider so that I can get in. And damn, I feel extremely claustrophobic to get inside an MRI. Now think about Mary. How would she feel 45 minutes inside that particular machine where you have continuous sounds coming in? And that's where, you would need to rethink or redo or revisit or remodel, reboot your entire thinking around a healthcare process to ensure that it is safe, you have the engagement of the customer, and you are delivering the right clinical decision support that it's required out of that. I would leave it to you to think through And let's go back and revisit this in the question answer session you wanted to. What would you like to do? What is the kind of thing that you would like to do to redesign a process like that? So if we have a time, we will have a discussion on that. Now that brings into, the elemental form of how you redesign or remodel healthcare. And that is something, the work that we are currently doing. This is a published work from MIT CSAIL. One of our professors, Professor Regina Barzilay, has been working on breast cancers for the past 5 years. And she and a team, and we are of course a part of the research from a validation point of view, are now able to identify and predict breast cancers from mammogram images, old mammogram images, using AI with an accuracy of around 80%, and say if the person would have a breast cancer down the line in next 5 to 6 years. Now, this is fundamentally two elemental things in AI in health which needs focus. One, of course, the image analytics, and a lot of work has happened. Everybody these days, whether it's in terms of chest X-rays or stroke identification or any one of these, are using AI and getting much more reflective clinical decision-making in that term. But the second part is most interesting. And it says you are making predictive models which will allow you to predict if the person, including their EHR and other factors, or health records and other factors, if the person would go and develop breast cancer in 5 years. Now, if you know that somebody is going to develop something in 5 years, you would be taking proactive measures to control that risk. Of course, there are a lot of ethical questions. There are things that have happened with Angelina Jolie and stuff like that. I don't want to delve into this discussion at this point of time. But then the fact is, technology is available on this day to build models which will say what is going to happen in 5 to 7 years or 10 years or 15 years. We built a very similar model for cardiovascular disease, which is on the way of publication in Lancet. And it is much more powerful than the conventional risk scores that are there, right? And even here, you can see it is beating out the conventional models like the Tyre-Jusek risk assessment in diagnosing breast cancer. Okay. And also something around the COVID as well, where we are now publishing a paper which is with a very high percentage of accuracy. We are now able to predict if a person would require ventilator support or would have succumbed to any kind of, would die in next 7 or 28 days. So we have been able to identify or build models around that. And that's the work that we have been doing in COVID. Now, ladies and gentlemen, one important aspect that I must tell you in the context of COVID and AI work that has happened. Every facet, how old is COVID? 10 months, 12 months, that's what we know about it, right? In 10 months, 12 months, people across the world have shown a tremendous camaraderie to actually build in, share data, and come into a common platform to use AI in COVID diagnosis, in early detection, in a detection with chest X-rays. Here is an example where we are using something. You can go into Apollo 24/7 platform and you can see that, where we do detect COVID by cough sounds, right? And the severity of the illness. Then they have gone up to identifying, the mortality risks. Then they have identified, allocation of resources through AI models. Which part of the country you would have from a public health perspective, how the risk status and how the mitigation strategies are working or not working out of that. Then move on to something which is related to drug discovery. Move on to something which very recently DeepMind from Google came out with a protein structure, right? All through AI models in a span of 12 months, 9 months. And this particular thing, for people who know about coronavirus, the whole research from 2003 to 2018, 2019, that did not flourish as much as what we could achieve in 9 months. And that is so important, from looking at the power of data, the power of AI, the power of cloud computing, and bringing in all of that together to actually find out new solutions in the way that they are. This is my last slide, and I would like to talk here about 2 things. One is, do not give up on the visualization aspects of analytics, which is very, very important as well. This is somewhere we were looking at the different outpatient clinics and different, COVID-related patients coming to different specialties and doctors at different parts of the country. And this is where I want to end my talk, a very interesting thing. If you can see this, you'd see a clock that goes from, 24 hours. So this is 4 hours clock. And these are made of concentric circles. And you would see that this is the first day, 30 days are there, first day, second day, third day, through the 30th day. Now, this is a gentleman who are the one that we talked about in our fall risk assessment and the IoT use. This gentleman has Parkinson's disease. People who know Parkinson's disease would know that they have tremendous challenge in the ability to move, to actually, do their activity of daily living. So the blue ones are the ones where he is in the bed. In the green, he wakes up and sits on a chair. This is the block where he is actually doing some activity of daily living, like going to toilet and doing stuffs. And then probably he goes out of the range, because these are collected by AI-enabled sensors, contactless sensors, which are there in the room, which can penetrate the wall. This is a solution made by Professor Dina Katabi at CSAIL at MIT. And then the person does a lot of activity throughout the day, moves around a bit with support, and then again sits on chairs from 6 p.m. and goes bed on that. I want you to focus here. This is where the caregiver of the person arrives at that time. The caregiver remains for a certain period of time of the day, and by 12 noon, she leaves. The person is then either on the bed or on the chair. And this is probably, again, she comes back in the evening where she takes her in a wheelchair, takes the person outside for a walk. And then again, the person would sit before goes to bed at 10 p.m. and again wakes up at 3 a.m. One of the other things that Parkinson's does is that it reduces sleep. Now, when you have this kind of data generated from contactless sensors and AI-based solutions in the home of the patient, you are able to channelize when to give the medication so that the person becomes more active, when to give the medication, or when the daily dose of the drug has to be calibrated across the day to make the person more effective and in a way that it actually makes a sense to that. With that, I'll stop here and I'll try to log in where I can use my video, but we'll be glad to take some questions.
Ashish, you can ask questions.
Yeah, so I'm just expecting him to come back on video.
Yeah.
In the interest of time, we can start the question answers and I'll join as early as I can.
Sure. First of all, thank you so much, Dr. Kar. I think it was a phenomenal session and quite eye-opening as to how much, AI is helping, to come and, cater to these issues for the humanity. Your examples of, people There's a lot of echo coming in. Yeah, I can see you on the video on the other device.
Right. Is that okay now? Is there an echo?
No, I think we are good. So I can see that you have used technology very well. You on one device you have video, and the other device is the audio.
Sorry, yeah.
No, that's absolutely fine. So what I was saying is that, the examples and the use cases which you have given from, people, thinking about dengue finishing on a Dussehra day to, the girl who was being put on an MRI, phenomenal use cases. I think you said that you want to take up that girl's MRI use case in the Q&A section, and I'm excited to know, how that use case was handled using AI.
Right. So possibly, so on the very first instance, when the girl came to get the MRI and she was put inside the MRI, she didn't even, hold on there for about maximum 2 minutes or 3 minutes, and had to started crying and had to come out. And this happens with, young girls when they have to go into that kind of an environment. So the process is you would have to sedate the child. You'd have to give this child some sleeping injection, if I may put it in that way, and keep the child like that for 45 minutes and has to be monitored by an anesthetist in that term. So you can understand what is the kind of pain that the girl or people are going through at that point. The solution is that there is a handheld device that has been now been studied and has been looked at, which is coming up as a technology, proprietary, built at MIT, but then of course now we have some other companies who are joining in that thing, which can just just like as we shave the hair, so they can put it like an ultrasound and get a very similar image with NI-enabled softwares which can pick up it from a 6.5 years old brain to identify what are the structures that needs to be seen for a disease like what she is suffering from. And these are the things which are going to make life so easy for people, and that you don't even have to go and do it at a radiology department. You can actually do it at a clinician's office and get it done and do it easily. So that's where the research is moving into. Probably in next 5 or 10 years, we'll probably see that coming up.
Wow, wonderful. So I've got a lot of questions for you. The first question is from Sandeep Kothari. His question is, dear Dr. Kar, please guide if mind mapping concept can be used in data analyzing for digitization.
Mind mapping.
Mind mapping.
Okay, the nearest thing that I have learned or I have seen is talking about something which has been happening around several institutions, but one institution of very much of a repute, Mila, and that is from Montreal, Quebec. And I want to bring in one of my gurus, Professor Joshua Bengio, who actually works on this. And he talks about attentive machines, conscious machines, and at some point, through unsupervised learning, cognitive machines. That is the nearest that I can think about the answers. So if somebody is interested in those areas of research where we are looking at attention, where we're looking at, consciousness, or even for that aspect, causality frameworks, more than glad to engage.
Wonderful. So nice of you. The next question I have is from Balaji Lakshman. He asked us, does it make sense in a hospital chain to have patient data available across hospitals, intra and intercity, rather than limited to one location?
Absolutely makes sense. Absolutely. And this is exactly we are looking at, due to the constraint of time, you need to think it in terms of data. In terms of blockchain, where you would be able to push and pull data. You would have to have, those aspects which we normally see in blockchain of immutability and stuffs like that to bring them into one steady consortium. Now, this consortium of data can be within a single group, right, of the multiple hospitals at different locations. What is the use? The use is the one that we just saw in the Trinity Healthcare case, where, for any person who is going into that particular hospital, he doesn't have to carry the files and files and burdens of medical records with him or the images with him. He goes and meets the doctor. Doctor asks for a particular patient's data. You can put it with the different security purposes like OTP or somewhere in that way. And you get all of this data that probably, has been looked at in Delhi, but you are currently in Hyderabad or Calcutta. Every time the interaction happens, you are able to push that data, right, to the servers, to either to cloud or to your internal servers, where this can be used in further. And when I mean by further, next clinics that the patient would go 15 minutes hence. So that's agility.
Absolutely. Somebody's planning, somebody's traveling international and unplanned medical emergency. You can get all your records available.
Yeah,
absolutely. Thank you. The next question I have is from Nina. She's asking, can you please provide references to work done for predictive model for breast cancer detection? Also, is it being used anywhere already?
This is still a research in motion. I'm so thankful for asking this question. So this has been developed at Massachusetts General Hospital, MGH, and Harvard Medical School. This has been validated in Karolinska Institute in Sweden, and also in a hospital in Taiwan. And of course, we are also in the process of doing the same. But this is available publicly. But if you want the paper, I can have it sent.
Okay. There's a question from Suhas. He's saying that what measures are being taken to avoid the human biases from entering in the AI and to make it more ethical?
Wonderful question. So maybe, CIOs of India can again ask me to come back with my favorite topic on the subject of ethics. Ethics in digital health, ethics in use of AI. See, we now have biases from everywhere. When we do the AI research, we see biases coming out from geographical, gender, temporal biases, biases from physician in the way that they capture notes, biases that come from, the different machines, different types of machines that speed the data, right? So how do we go about in normalizing them? So we have found out ways by which we use statistical methods in normalizing in that way, but there are obvious chances for us to miss out on certain elements like this. But then, most important for anyone who is using AI these days and in any field is, particularly if you're doing something related to human, human data, is to bring in the concepts of inclusivity, is about bringing in the concepts of fairness. And that is what we saw, in Indian example, and this is something which is available at the WHO website. When they try to link Aadhaar with health records, a lot of patients with HIV and TB, they just, moved out of their programs and they said, we are not going to be a part of that program when you are linking Aadhaar with digital health records. So we would have to see in terms of these biases setting in the society. And this is a larger AI and AI for health or AI for human good question, which needs to be appropriately answered. in the domain. It's for society, it's for policymakers, it's for industry leaders like you to come over and have that conversation to see how we restrict ourselves from these biases that set into systems while building these AI models.
Fantastic. It's more of a statement from Rajesh Batra that patient data is important across hospital for mobility with multi-speciality and need to come with checks and balances. In fact, doctors RX is the best case for blockchain since Rajesh is from the healthcare background. The next question is from Kamal Mata. He's asking any usage of AI done in COVID spread control so far?
Sorry, I couldn't get it.
Any usage of AI done in COVID? Can you hear me?
Sorry, I missed out the last part.
Usage of AI done in COVID spread control so far?
Yeah, so there are different models that are there that have been built across different institutions about, spread of the COVID and identifying, how many people are going to be affected and all of that. And typical SIER models that we see in epidemic forecast or stuff like that. Most of the models didn't work. COVID is teaching us a lot, and we are learning on an everyday basis. The best model that I know so far has a accuracy level of, in predicting, particularly from an epidemic focused model, has accuracy of 65–70%. And that's as much as what we could understand from this entire pandemic and the way it spread. Some people overestimated, some people underestimated, but there are very few people who have estimated it within the range of that. And that's typically because of human behavior, about the capacity of the virus, and the public health precautions that have been taken over the period of time.
True. COVID is a great teacher for all of us. We all are learning every day. I'm going to take the last question from Suhas. He's saying that I'm interested to interact more on the AI, ML, and blockchain front. Please let me know how to connect.
Sure. So through CIOs of India, yes. Kamal and Dipesh, we can be connected and we will take it forward.
Right. That's what I was about to say. So Suhas, you can send your questions and to us, and we'll help you connect with Dr. Kar.
Question, Dr. Sujoy. Thanks for this insightful session on digital transformation and use of AI in healthcare. This was quite futuristic and breathtaking. At least for me, with an academic mindset, you have shared a lot of references, which are going to be very useful for me for my academic orientation. Thanks for the session, and we will definitely have another session of yours in coming time. Thanks to NetFoundry team. Thanks Dipesh, Suren, Sandeep, and Bernice for showing quite an interesting product coming out of India. So thanks NetFoundry team. Many of our CIO friends said that they would like to interact with your team. So hopefully they would be filling the feedback form, and then you can get in touch with them. And if somebody specifically asks us, then we will connect them to you. So thanks for this session. Now, last, I would like to thank our moderator Atul Govil, then Ashish for asking a lot of questions, and other EC members of CIOs of India, especially Naresh Pathak, who is supporting this event from backend. So thanks to the entire CIOs of India Executive Committee members team. With that, I think we are done for this session. So all the friends, thanks for coming for this session.